Welcome everyone to the second EHDEN webinar. This webinar is about the EHDEN project, and we will provide you some background on the project, its objectives, and also where we are at the moment with the project. My name is Rijnbeek. I'm Associate Professor Health Data Science at the Department of Medical Informatics of the Erasmus Medical Center in Rotterdam. And I'm the project coordinator of EHDEN. And I'm here together with Nigel. Nigel, maybe you can introduce yourself.
Hi, afternoon, Peter. So I'm Nigel Hughes. I'm a scientific director for real-world data, real-world evidence in Janssen Clinical Innovation, based in Belgium. And I'm the project lead on the industry side, obviously collaborating with yourself on EHDEN.
Right. A great project to work on,
Absolutely,
I would say.
absolutely.
So, just for you, if you have questions, you can type them into the webinar tool. And we will see them on the screen, and we'll try to answer your questions during our conversation. We have a couple of slides as well, but it will mainly be a conversation between you and me, Nigel, on this interesting project. So let's start all the way at the beginning. So when did actually the idea from FPS started to create the open call on this topic? And what was the rationale for creating that call within the IMI framework?
Thank you, yes. Actually, this goes back a little while now, to at least 2016, 2017, in terms of the inception of the project. It was in the IMI, so Innovative Medicines Initiative framework, and IMI, for those who are not aware on the audience, is a public-private partnership between the European Commission via the IMI office and FBIA, the Trade Association for the Pharmaceutical Industry. Right. And it's the largest public-private partnership of its kind in the world. It's about 5-6 billion euros over 10 years now, over 100 projects. Ideas kind of promulgate through FBIA, through pharma companies, where there's thought to be a need for a public-private partnership kind of consortium and collaboration. And originally, distributed data network, as it was called then in 2016, was proposed to meet the need of interacting with real-world data in Europe. Became EHDEN, European Health Data Network, and as we'll talk a bit later, the European Health Data and Evidence Network. I think the key to this is it's a consortium. So it's a public-private partnership with its funding matched from Europe and from industry. But it's a true consortium between public and private partners, which we'll talk about. But one of the key challenges, of course, is that with real-world data, as we all know, it's not like randomized clinical trial data. It's extremely inconsistent, of course, lots of variation in the data and so forth. Actually, in the slide, you'll see this ion, this steam ion, and the idea being that if you want to use that in various different electricity sockets, they vary all over the place, of course, and this lack of interoperability, if you like, is a key challenge. So it's going to require a number of things: interoperability, multiple systems, different languages, human and machine. Right. Standardized analytics, of course. So it's not just about the data itself, but how we go approaching analyzing it at scale. The data network, and we're going to talk a lot about that obviously today in regarding EHDEN, in particular the nature of a federated network, which we'll come to. And importantly, and I think this is a key thing, because it's about a socio-technical construct. It's not just the technology. The data, of course, it's about a community and creating a community, of course, that's sustainable right. with convergent interests around research.
And when we talk about that data interoperability, so the issue there is both the structure of the data, yeah, and the terminologies used in those different systems, right?
Yeah, indeed.
Because that's something we have encountered in earlier exercises where we've been mapping data to a common data model for that reason. It's very interesting to see that for some reason everybody thinks they can design the best data model in the world, and right. there's no consistency across those different data sites. Right. And that's challenging, especially if you want to apply standardized analytics on top of your data and want to do that in a federated way, in that sense that the data stays local, yeah. and we bring the tool to the data. We definitely need to improve the interoperability of the data to make it faster and more transparent and reproducible.
Yeah, no, absolutely. And also at scale. I think this is the challenge right. increasingly now. We've gone from capable of doing small studies and small bouts of research to now most studies using real-world data are cross-border, across digital borders, and multi-center, and so forth, and that also brings its challenges, of course. Yeah.
And then the terminology system is the other thing that.
Right.
So even though we're Europe, we don't speak the same language in our electronic healthcare systems.
Well, I can't comment on that with a British accent at the moment, but yeah, absolutely, it's not quite the United States of Europe. No, understood.
Right.
Yeah, understood. And certainly, there are many benefits, of course, for all sorts of stakeholders and so forth. I mean, EHDEN predominantly is focused on outcomes research, and clearly that's really focused in the long term on outcomes for patients, citizens, and so forth. But also regulators, payers, from a research and development point of view, and that also brings its challenges in terms of needing harmonisation and standardisation, of course, as well. So that being said, what drove, from the public consortium perspective, the idea to create a consortium and become part of the EHDEN project?
Well, what you normally do when there's a call like that, you look at the call and you think for yourself, is this a topic that I want to spend the next 5 years of my life on? Right? It's quite intensive it's a lot of work to write such a proposal, to get the consortium together.
Right.
So you need to have some passion on this topic. You need to have a strong vision on the topic. And I was very happy with looking at the call text, because it was a very natural fit with the work that we were already doing at Erasmus. It was a very nice continuation of the EMIF project, European Medical Information Framework project, where we started already with mapping data to the Open Common Data model, and we had some very good partners there that could build tools and extend tools, and we could reuse tools also from EMIF in this project. So for me, it was a kind of a no-brainer to write a proposal for this topic.
Right.
And like I mentioned, we were working on Odyssey, Observation Health, Data Sciences and Informatics initiative for a while already, and we were coordinating also the European initiative. So we organized a European symposium, as you know. So we were already on that track. And for me, it was fantastic that by EHDEN and EHDEN, as it was called at that time, still in the call text, was a very nice continuation of the work that we were, the road that we were on already. And I also was very happy with the consortium that we can bring together and the people that were already in our network. And what I really liked about the call text was that it was very prescriptive. It very nicely told us what direction we had to go. So it was not open to which common data model are we going to use. It was prescribing that we're going to do the open common data model, which saves us a lot of discussion. So it was very clear focus. I also very much liked the fact that there was a push for a smaller consortium.
Yes, we kind of learned from previous projects, I suppose.
And I think that's very nice, because we need to have a very clear focus in the project. And looking back in the last half year or so that we're working now, I think we see why that is so important. So that's something that I really liked about the call. And also what was good, I think, is that at that moment when we were at writing stage, we were in a kind of perfect storm for OMOP CDM in Europe, building the next level of pharmacoepi kind of system and ecosystem was perfect. There was a lot of interest at that moment from regulators that had a meeting in December that year on which common data model.
2017, if
2017, and also we already had contact with some FBI partners or pharmaceutical companies that were interested in mapping their data, and there was a lot of activity, of course, in the US with Odyssey. So it was a very natural fit for us, and I was, of course, very pleased that we are able to do the project now as well, together with the FBI group.
I think we're going to talk about Odyssey a bit later, but maybe you'd like to outline on the public side, because on the industry side we have 11 pharma companies, mostly like large pharma, some smaller. But actually also we have 11 evenly matched public
Yes.
partners as well. So maybe it'd be good to outline who they are and some of the
Sure,
background
it's
there as
almost
well.
like two soccer teams, right?
Yeah, but we're not playing against each
No,
other.
we're playing with each other. That's absolutely true. I'm happy to introduce the partners.
Okay.
As the call text already prescribed, that we had to have a combination of academic
Yes.
centers, small to medium enterprises who had expertise in this area, in this domain, and some other institutes like a patient organization, etc., an HTA body. So based on that, we formed the group, and I was very happy that we had a very nice network of people already that we can bring in. So we have universities like Erasmus Medical Center that I'm from, of course, and that's leading the project from academic side.
Yeah.
But also Oxford University is in there, and we had a nice webinar earlier, the first webinar, where Dani presented his initial work in EHDEN on doing the study-a-thon on devices.
Yes.
And so they have a lot of expertise there, also in prediction, which is very welcome for the project. Of course, there is the Avera group. They have been in the EMIF project building things like a database catalog that we will be reusing in the project, and have a lot of expertise in that domain. We have University of Tartu. They have expertise in bioinformatics, and they are one of the Elixir nodes. And so they bring important expertise in that domain.
In a particular context that is interesting in Estonia.
Yes,
they have some very interesting perspectives.
And they have more expertise also, like on predictive analytics, and they've done work on disease trajectories, which is also part of some of the use cases that we will work on. Then we have, of course, NICE, HDA body. Most people will know that they are very important also for the outcomes related work. On the non-profit side, we also have European Patient Forum, which is like an umbrella organization, and that's important to have the vision of the patient and the patient included in the project, I think.
And also for transparency of what we're doing and so forth, I think it's fantastic.
And ICHOM is all about outcome standards, and they've been building a lot of these standards by now, and they will have more during the project for sure. And we wanted to include them. And then we have the SMEs, of course, Synapse as managing organization that we've been working with for a long time and been very successful in supporting IMI projects.
A lot of projects.
A lot of projects. Yes, it's amazing. So I'm very happy that they are helping out, because it's not my biggest hobby to do all the administrative work. So neither for you, probably. And also two companies like the Hive and Odysseus, and they have a lot of expertise in ETL mapping from source to the common data model. They build open source tools, and especially also Odysseus, who is responsible for vocabularies in Odyssey already. So they both have a strong link with Odyssey, and they built nice tools that we wanted to reuse in the project.
And Kay's from the Hive actually did the first webinar.
He was the host of that one. But maybe we should move on. I don't see any questions yet, so let's move on maybe with explaining the vision and the mission of EHDEN. So to put a little bit of context around this.
I mean, everyone these days has a mission statement and a vision and so forth, and we're no different, of course, from EHDEN. But a lot of thought has gone into this based on where we've got to over the last sort of 18 months or more, actually, almost 2 years. But in essence, EHDEN, European Health Data and Evidence Network, wants to develop a federated network. And what do we mean by that? Well, you mentioned it earlier, that it's a network where data stays local. So we don't move data from where the source is, say a hospital or a primary care network or similar. But we take the analytics, the question effectively to where the data is for an answer. And that's also important in today's world because of things like GDPR and privacy by design and these kind of things, regulations. But standardized to a common data model, and we'll talk more about OMOP and Odyssey in due course, that more smartly manages and shares research methodologies and expands education and open science and collaboration. And what's really nice about this mission statement, I think, is it covers not just the data science, if you like, the bioinformatics aspects, but also research and research use cases and methodologies, but really importantly also education, and we're going to come back to that later about the academy. The vision overall, though, is that we are the trusted observational research ecosystem to enable better health decisions, outcomes and care. And I think that's critically important. Although this is an IMI project and we run for 5.5 years, so till 2024, we're aiming for something that's long-term and sustainable, right?
Right.
And that has to have impact long-term down the road in terms of outcomes for patients, in terms of new evidence, and so forth.
And that's actually the reason why I really like the E in the acronym.
Right.
So the original acronym was European Health Data Network.
Correct.
Which suggested a little bit that what we were doing was building a data network and leave it to that.
IT.
Like an IT project where that solves some of these interoperability issues, and then that's it.
Yes.
But that's definitely not the goal of the project. So I like that one of our FPA colleagues, actually, when we were writing the full proposal, suggested to add the E.
Celine from UCB.
Yeah,
exactly. That's right. Yeah.
It also sounds better, like Eden. It's a kind of paradise, data paradise, which is quite nice. But having the E there, I think, is fundamental of what we're doing. So if we don't run studies on a network, I don't think we're a success.
Yes, agreed.
Because you agree with that.
Indeed.
Even if we would map like hundreds of millions of European citizens to that data model.
Yeah.
And then don't do any studies with it, I think we fail.
No, absolutely. Though if we're using the Eden analogy, disturbingly, that makes one of us Eve and one of us Adam. We probably must not get into that, but in terms of a bit deeper in terms of what Eden is trying to do, maybe you'd like to explore that a bit further on the mission and the vision.
Absolutely. So it's actually, the circle is actually quite nice that you see here. It is an iterative process that we're on.
Right.
And of course, not everything is clear at the beginning of the project. It will evolve over time. But there's a clear, of course, driven by our mission and vision to improve patient care and healthcare.
Yeah.
So outcomes is fundamental in everything that we do. We should always keep it in mind and not end up with some either academic exercises or only infrastructure exercises. We should keep that patient really central. So outcomes is it's more than only the ICHOM standards and that stuff. I think that's very important as well. But it's also about improving the methods that we have, the analytical tools that we have to answer other type of questions. So even things like predictive analytics that we have a work package on, I'll talk about more later. Improving those tools is also definitely part of improving patient care later on.
Do you think speed to an answer is a critical aspect today?
I think it is a critical aspect. I do think that there's quite some confusion about that. If you have more speed, you have less quality, as if that is a kind of balance. I think we want to stay away from that. I think speed is a goal, but it's not the end goal. The end goal is to create that reliable evidence that we need. And if that means we have to slow down a little bit, we should do that. On the other end, there's also a kind of obligation, I think, that we have to our patients, that we should bring evidence quicker to the patient. It's a kind of strange that if you have a risk minimization question or something like that, and it takes a couple of years to give an answer to that question, even if it may be simply a drug utilization question or something like that. Right? And I think by doing the standardization, we can improve the speed without losing quality, and we need to make sure that that's the case. So within Eden, it's not a matter of just using the tools that are out there and running it. We should also evaluate that in that perspective.
Yes.
But the harmonization, which is the yellow layer there in the circle, is of course crucial to get there. And we've seen from Odyssey that the type of studies that we can run when we are in that situation is very, very interesting. And like the webinar the previous webinar, where they showed that just by bringing together a group of people for a week, you can answer a clinical important question almost up to the full publication. And I'm quite sure that the methods that are used there are of very high quality, and we do all the propensity score matching and everything that's needed is there. So it's not that we are lowering quality in that sense.
And indeed, at the kickoff meeting in January for the project for Eden, when that was presented about the study-a-thon, it was really like a wow factor. The whole audience was like, "Wow, you can do this in 5 days." It was astonishing.
I remember that we had the American Odyssey Symposium last year, and we did a nice exercise there. That was more on predictive analytics, where we asked the audience, what would be your most important prediction problem that you want to have solved as soon as possible? And people could put their IDs in a Google form, and we selected the top 5, and then we had the whole audience, like 450 people, it's a quite big audience in the US, vote on those top 5. and they selected the best one.
Okay.
What they didn't know was that in backstage, so to say, we had a whole team ready.
Nice.
So people with medical knowledge, data scientists,
Right.
etc. And so what we were doing during the Odyssey Symposium in US backstage was working with that team, going through all the steps of designing the study, running the study,
Right.
executing the study on data.
Right.
But what was very impressive, I think, is that we were able to execute the study also on other data sets. So we did external validation, as we call that, from our predictive models. And we were able to then, at the end of the day, so that's even in one day, we were able to project a shiny application, a web application, showing the results of the predictive analytics, not only on that initial data set that we trained the model on, but also on all the other data sets which were across the world. And it's not that the point here is that we need to have this done in a day. I don't think that's the point. But the fact that it's possible is very interesting because it opens up some possibilities for us to do it at a much more larger scale, so to say. So, and harmonization is there a key element. The federation, of course, is also then necessary.
Right.
So we could do this now because we could federate. We could actually send that R package that was automatically created by some of our tools. We could send that to the other sites and have them run that. So that's, and in EHDEN there's a task for us to improve the federation by including the tools that can run that automatically also, and with, of course, also with a manual step of the data custodians in between. The other part of the circle, like community, is crucial, I think. And this is also what I always really appreciated from Odyssey and my involvement in Odyssey, that community building that's happening there is fantastic to bring on board also in our project and extend in Europe.
And principle to that is trust.
Yes, it's trust, and it's people that are interested in the topic, have the same vision that we have.
Right.
And if you look at the Odyssey Symposia, the two Odyssey Symposia that we now organized, we had one in March, and you can see it online at odyssey-europe.org. It's amazing how many people appear at those meetings, and how the energy is, and that people sign up for training as well. That brings me actually to the last education point. I think that's a very big thing that we need to work on in EHDEN, and I'll come back to it a little bit later. But I think that's one of the things where we can excel and make sure that all our stakeholders are very well trained and understand what the CDM is, what it's not solving, etc.
I agree, absolutely, yeah, indeed.
So yeah, these were the background of the project, but that's, of course, that was the reason why we made some design choices in the work package, etc. So maybe you can touch on that one.
Yeah, and some people have seen me present this slide ad nauseum, so and it will continue. But I think there are a number of key components in any large-scale project, or even small-scale for that matter, that we're talking about that are kind of critical, and without them being attended to, the project will not work. Right. And the same will apply for EHDEN. So we're kind of we call it the kind of build, fuel, and drive. So we're building a network, an engine, if you like, in this case. We need to fuel it, and that's actually with real-world data in this instance, and then apply that, utilize it for research use cases and so forth, or drive it if you like. Yeah. And all of those are supported by technology, and we use a lot of predominantly open source technologies within EHDEN, but actually in IMI projects quite commonly. And that's fine, and often most people kind of stop there. But as we've been saying for some time, many of these collaborations are socio-technical. And the social aspects are we need to engage those who have data. And what's the quid pro quo? What's the balance for them? Why would they share that data? If it's a hospital or primary care network or an integrated regional database, it's their data that they're working with. Ultimately you could say it's the patient's data, but at least the institution. And there needs to be some kind of convergence, some kind of quid pro quo as to their interests, the interests of yourself, for instance, as an academic, myself representing a pharmaceutical company and so forth. It's not based just on money, but on, as you were saying earlier, creating evidence and getting greater insights, of course, as well. And then outreach, of course, is very much about, well, where will the evidence land? You know, with payers, with governments, HTA bodies, the regulatory authorities, and so forth. And how much confidence do they have in how that evidence was generated, and the source data, and all these kind of things. And it's one of the reasons, again, why EHDEN was created in some respects to create that kind of transparency, wasn't it? And ultimately, then going from a question to an output or outcome. So this is kind of critical, I think, for projects in general, but also for EHDEN. In some respects, our work package structure kind of reflects that, and we could probably look at that next.
Yeah, let's do it. Yeah, so the work package structure is actually built around that idea of that you just explained, and so there are a limited number of work packages which I like, of course, led by somebody from public side together with somebody from FPA, so it's always the dual leadership, which is great, I think.
Yeah.
We have more technical work packages. The work package 4 is technical implementation. It's a very big work package.
The engine room.
The engine room, so to say, yes. And yeah, the goal there is, of course, to bring all the tools together that are already out there. Like you mentioned, it's not about building so much new stuff, although if it's necessary, we definitely will do that. But we will start from what's out there and bring that together in a framework, so to say. There's also, of course, the work package 7 is project management. That's where Synapse and others will play a very important role. But then, get the view is mainly it's a big task in EHDEN to get those data sources interested, to get them mapped, so to say. So the work package 5 is about the data workflow implementation and service deployment, as we call it, which means that will go all the way from the data source is the SME wants to be trained, right? And we'll get back to that.
And
but also certified, and the data sources want to get mapped, and how do we get them from their source data to the mapped status, so to say. And work package 5 is implementing procedures for that and creating also some tools for that, or reusing tools for application in the calls, for example. Work package 6 is outreach and sustainability, as you mentioned. This is a very important work package as well, to get people on board, and sustainability, and we'll get back to that a little bit later, I think. Sustainability is, of course, something that we have to think about from day one, and it's very hard to make that happen for IMI projects, as we know.
It's been a challenge, correct?
Yes.
Yeah.
Well, let's park that for now.
Indeed.
Then the work package 1, 2, and 3 are more to drive the development. So it's the idea is that these work packages will run use cases, and these use cases are there just for pushing the development, so to say. And work package 1 is more evidence work for development, like a broader container for some use cases that we will show. Like, for example, here, the drug utilization study is one of the work package 1 use cases. So the goal there is to see how well we can do drug utilization studies on top of the common data model, and that is a very nice and very concrete problem, so to say. It's very everybody understands what we're doing there. We want to create curves on drug utilization, but it should be agnostic, of course, to the type of drug. It should be a tool that we can use for this type of studies, but also then move from running a tool to creating like a dashboard of drug utilization, and make sure that we can execute these studies in a quick way.
So for this year, initially, these are kind of pilots, right? Validated on OMOP map data that we already can interact with, right? But then beyond that, we'll do even further expansion of use cases and so forth.
Yes. So we have a question there. So the question is: several countries are in the process of developing their own improved e-health systems, and they are already in the planning phase or even further. So how easy will it be to integrate such activities once EHDEN has created a common platform, in particular if such national systems will try to stick to their own map, to their, I'm not sure what that means.
Maybe OMOP.
Maybe OMOP standards. Well, we are, of course, discussing with all different countries already, and it's quite interesting to see that even at national level, people are getting more and more interested. It's not, I think we should distinguish a couple of things. It's not that the OMOP common data model should be the standard for everything always, right? It's also, if you look at our own data set internally, We have our own IPSI database, which is a GP database. We currently are working on the native system, and we also have a CDM system, and we want to move to maybe only the CDM system. But I think what's the power of the OMP CDM is mainly that interoperability between different centers, right? And that's what we want to push for. I don't think we are in any position to push a country to adopt the OMP standard. If they can, it would be easier.
Sure.
But I think it could be a layered approach as well.
And it's agnostic, isn't it? I suppose, in lots of respects. To, for instance, whichever EHR system that a country or even a centre or centres are using, and which are multiple different vendors, and obviously different approaches there. But this is about being agnostic, almost like a Rosetta Stone, if you like, at the centre of this. Yeah.
Yes, and I think it's good that we have very open conversations with all these stakeholders and people that are standardizing are interested to also add that OMOP layer on top of that. Ideally, of course, the whole Europe is only working on OMOP, but that's not something that we can enforce. I think we should show by use cases that we have that people get interested and want to participate.
So it's not about doing something different, but it's definitely about doing something that's complementary to what they're doing.
Yes, I think so.
Okay.
I hope that answers that question. Let's go back to the slide.
I think that segues nicely probably into Odyssey, actually, as well. I mean, she's been very successful so far.
Yes.
But how does EHDEN fit, as it were, and what will that add in terms of what Odyssey's been doing? Maybe you want to kind of explore that a bit as well.
Sure. Yeah. So I've been involved in Odyssey for a long time, very happily so.
And sorry, the Observation Health Data Science and Informatics framework.
Yeah, exactly. And they've done an amazing work. And they've created, of course, the CDM, and it's a community effort, so it's been evolving over time, which is something that I very much appreciate, because it should be a community-driven exercise. The tools are fantastic. What I find very interesting for EHDEN is that we have like a dedicated project, 5-year project, which is quite a nice time period. In which we can move it to the next level, and I think that's on different elements that we can look into. One, of course, is training and education, right? Yes. And we have one slide on that.
I think we do, yes.
Before we go to that specific question, if you can move, one more. Oh, I don't see it on screen yet. It's coming. Okay, well, there's one slide that we had on the academy. So one thing that I think is needed for Odyssey to make the next step, and EHDEN, together with EHDEN, is to make sure that we train our stakeholders. There are still a lot of questions about the CDM, on the use of the CDM, about how the tools should be used, how the cohorts should be built, etc., etc. And I think we can make a difference there. We have the resources, and we can build a very nice framework for it.
Yeah, absolutely.
And we already started that, right? Yes. So we started with the EHDEN Academy, where we have an e-learning system where people can log in and they can follow courses. And we are currently working on a course on CDM and the vocabularies, but also on ETL, right? So how to get from your source data to the CDM, and what are all the steps that you need to go through. What's important here is that because of the small to medium enterprises that we will be training and certifying to do that task, we need to have that e-learning system in place, and it needs to be running actually very nice and easily without too much resources from our side. So that's why the e-learning approach is actually a very nice one.
Great.
What's also nice to mention in the academy development is that we are working with virtual machines. So we have like a system, an environment that people can log in, and that contains all the different tools that are out there. So the Atlas tools for cohort building and other tools for doing ETL are in that environment. So every trainee get access to all those tools, and we can, in the training, we will build questions focusing on some of these elements in that environment. And I think that's a very powerful way to also scale up the learning activity with others.
I think you've called it Odyssey and OMOP in a box.
Yeah, it's Odyssey in the box is the original name. That's how it was created within Odyssey, and some of the trainings that we've been doing there.
Okay.
And I think that's one thing that EHDEN can help with. The other thing is, of course, extending the data network,
Yeah,
right?
indeed.
So we have a very nice position in the project to extend the European data network.
indeed.
That brings us a little bit to the harmonization fund, maybe, and the processes for the calls that we
Yes.
can talk to.
Possibly one of our busiest slides of the
Yeah,
show
let's
today, but yeah,
stop here
indeed.
for a while. Yeah,
But no, you're right. I mean, at the end of the day, amongst our goals and objectives is this creation of this federated network,
Right.
a community, if you like, as we've said, of different data partners, as it were, supported also by not just the project, but also SMEs, but small tech firms, if you like. And as a consequence, and following a lot of discussion, also inclusive with our IMI colleagues and many others, in terms of how to do this, because this is fairly unusual in an IMI
Right.
project, we came up with the idea of having these open calls. So the total project fund is almost 29 million euros, and of that, 17 million euros is a harmonization fund. So that's sacrosanct, if you like. That's specific and only restricted for the use of supporting harmonization. And actually, it means that EHDEN will enable a process where data partners, so hospitals, hospital networks, primary care networks, integrated regional databases, all of those, can apply to the project for a grant to cover the cost of mapping their source data to the OMOC Common Data Model, education. We mentioned that. I mean, we will provide a lot of free education, but also there may be requirement for costs there as well. And we have to have, of course, a structured process for that grant and harmonization fund and so forth. And I'll come back to that in a moment, but in the call process. Meanwhile, in parallel, as you said earlier, Peter, we want to train, certify quite a lot of SMEs over time in this kind of a growing marketplace in Europe, which is, again, supported by IMI as well. So we'll have open call. And we've actually just had the first pilot call, haven't we, in April, ended 30th of April. And we can talk a bit about that in a moment as well. But a number of calls for SMEs to apply. There will be to be able to trained and certified. We'll have a selection process. We're using internal and external experts for that. And the same applies for the data partners. And we're hoping around, I think, end of June onwards through the summer to have an open call for data partners. And then once selection of the first SMEs that have been certified after training, and the first data partners have met the selection process, again using internal and external advisors, with this kind of the speed dating approach, as I call it, between those. So data partners that want to be mapped can then be linked to the appropriate SME, and then the fund, of course, covers that cost from the data partner to the SME. And of course, we as a project will still have oversight of that, right? And this whole mapping cycle and so forth. So we aim also to keep that very, very simple as possible, but of course we have to follow certain rules and regulations and so forth as well. But certainly in terms of the call process, I think we'll learn a lot from the pilot call for SMEs and then this data partner call, and we'll kind of refine from going on there.
Yeah, we actually, well, like you mentioned, we had the SME pilot call started just after the Odyssey Europe Symposium, and we had it open for a month. And I must say, I was very surprised, or happily surprised, that the amount of SMEs that signed up was actually much higher than we would even expect.
Absolutely.
So there were 28 SMEs across Europe, a nice spread on different countries actually, that signed up for this call and applied for the SME certification and training exercise, which is really amazing. And we're in the process now of reviewing those. And as you mentioned, we have a review committee with some external and internal people that will prioritize the SMEs. Right. The idea would be to have like a top 5 of SMEs that we will start with in the pilot call. And the pilot calls, of course, it's called pilot for a reason, is that we want to also improve the processes that we're on and the training material that we have been developing. So those SMEs will be highly involved also in the further development of that process. And I think it's really interesting to see how much interest there is in the project in general, but also from these SMEs that definitely have to put some effort in getting trained and see opportunities for future for their companies, right?
Yes, absolutely. And we want to see that, of course, mirrored with the data partners in time as well. Yeah.
Yes. Yeah. Yes, and as you mentioned, we will announce the call for the data sources at the end of June.
Right.
We'll stay open for a couple of months
Yes.
and to make sure that we have also SMEs in place that are certified to help out those data sources.
Yeah.
So there's a question. The volume and variety of issues identified so far underscore the need for health information technology developers, hospitals, and clinicians to work together to design, rigorously test them before and after deployment at each of the sites. Any thoughts on how EHDEN plans to handle
them? Yeah, interesting question. I think one of the things that we also need to kind of demystify is what we will be doing at a site, so say a hospital network, and so forth, because actually there's a minimum really that's kind of installed. Yeah, I mean, and again, data stays local. We're not creating a central database or data lake. All local provenance is retained, so governance, approval processes, compliance requirements, IRB, you name it. All of that still applies at whatever the centre's involved and so forth. But maybe to the answer to that question, just helpful to outline a little bit about when you map what's kind of there. What it's a mirrored source, a mirrored version of the source data that's mapped to the common data model. Right. We would want to use some tools to enable the kind of research querying and so forth. Yeah, but it's not. There's no. I mean, you're not having to install servers. You're not having to install any significant architecture locally, right?
No, that's correct. It's just a database. Actually, you just transform your data into another structure. Yeah. But I do think that input from the community and from all the stakeholders that were in that question is very valuable in further improving that. So that's also why, like I stressed out earlier, the community ID is very important in this project, and this is also why Odyssey has been so successful, because there are people jump in. It's like a positive attitude to improving the current state that we are in, and I really support that. So if there are issues that we may not be aware of, I would rather hear that earlier on. Or if there are very good ideas of new analytical tools, it would be good to get some interaction, and that can naturally flow through Odyssey, but can also go through EHDEN in collaboration with Odyssey, I would say.
So in this instance, it's true to say that the more you put in, the more you get out.
Yeah, well, it's always nice that if something is getting successful, then you get an explosion of ideas, and I think that's a good thing. We need to find ways to constrain it as well to make sure that we end up where we said we would end up.
So would you agree that EHDEN is a recognition that we are having to work within a very complex environment, and a lot of things we cannot change, right? I mean, whether it's not even technical stuff, it's like the approval process. You can't harmonise, one European IRB, for instance, for research approval. That's not going to happen. No, it would be delightful, wouldn't it? But actually, therefore, is that another reason why using OMOP CDM, the Odyssey approach, and the kind of generation of community fits that in terms of it has this inherent flexibility, if you like, to work with existing systems and processes.
Exactly. You that responsibility is on the side of the data source, right? You need to divide that responsibility when you do a network study.
Yes.
Right.
Yeah.
So.
Yeah, indeed.
I hope that answers your questions. If not, please answer a second question.
Yeah, indeed. So we've talked about the call process, and actually, we're very pleased with the initial pilot call. Of course, there are some longer term considerations, aren't there, in terms of sustainability, and we're often asked this. I think from the start, and we don't have, and it's true to say, we don't have all the answers now today. But we actually have a whole work package 6, as you mentioned earlier, working on sustainability and value propositions and so forth. We know, and actually on the left is this graph. There's this Boston window, this 4-paner, which is looking at trust versus relevance, if you like. And we know that working with certain parties where they view us as trusted and relevant, great. Then we know we can build a relationship there. If there are people that either see us with very little, a lot of concern because they don't necessarily see how relevant we are to them, and they're not sure how to trust us, they don't know us, then that's an area where we have to do obviously a lot of work longer term. And so we're doing a considerable amount of work at understanding, if you like, the different value propositions for different stakeholders, aren't we? So whether that's SMEs for the certification and training, data partners, hospitals, and primary care networks, and many others I keep describing, patients, of course, because at the end of the day, it's their data as well. And also regulatory bodies, HTA bodies, and so forth. And we're very blessed with the fact that a number of the key stakeholders, key partners, in the consortium like NICE
Right,
and many
right.
others obviously can help drive this. But ultimately, we have learned, I think, from the Odyssey network in terms of it's been sustained now for some time. And I think you can elaborate on that probably, but we want to learn from how we can create a very large-scale community, not necessarily with a bricks and mortar institution or foundation or entity in the middle, maybe in the future possibly, but certainly not in the near term. But one of the key things is that we know is that for EHDEN to finish 2024 after the IMI project would be pretty disastrous, wouldn't it?
Yes.
Yeah.
Yeah, and I think there's a very big advantage that we step on the train of Odyssey, which is, in my view, Odyssey and OMOP is already sustainable.
Right.
There's so much uptake
Yeah.
across the world that this is not going to go away
Yeah.
anyway. But we have a clear role to make it even more, right? And I think the way we get sustainability, it will evolve over project. There are different options, of course.
Yes.
You can stick to what we call like the kind of open network where everybody can propose studies, can work together. I think there is a market space for that, or even a research space for that. On the other hand, we could have a more controlled environment as well, like having a small set of data sources, or let's say 10 data sources that work on certain topics, maybe for a regulator to answer certain questions with much higher control of quality. All these things are possible.
And the proof is, as they say, the proof is in the pudding. So as we see more evidence generation through a network like this, and greater confidence levels in terms of that evidence, particularly around authorities, regulatory or payer or government or whatever, that's also a key, isn't it? Because at the end of the day, then this becomes a useful resource, the network, I mean, and the consortium and the collaboration community, to all of these key stakeholders that we talked about in terms of the engagement step in that earlier slide. So I think then it's seen as valuable, and actually then it's in everyone's role to maintain sustainability.
Exactly.
Right?
Yeah. I don't think it should be only the responsibility of the IMI project itself to create sustainability. Sustainability is created by the world around that as well, right? So if there is a clear uptake for research on CDM and the federated network, academia will push for it and will work for it. If the regulators want to use it, they can make that happen as well. So it's a collaborative responsibility, I would say.
And that goes beyond just support from industry, and where we've seen it in the past, it has worked where projects can be continued to be funded by pharma companies, for instance, or under FBIR and so on. But actually, we're looking beyond that, I think.
I think that if you look at, for example, the SMEs, what I really hope is that we will also create a network of SMEs in Europe. So that we build the positive energy that we now have in the research environment around Odyssey, also in the SMEs, so that they can also work together, help out each other as well, if possible, and have interactive meetings, so like maybe hackathons with the SMEs that are certified to make sure that they stay on board and see the business opportunities as well.
Absolutely.
And that's one thing that I really like in EHDEN, is that inclusion of SMEs early on in the project, and hopefully they will grow with us in the next 5 years. And we'll also see other possibilities for in their market.
Absolutely.
So they together with us and the data sources that we will map, create a sustainable solution.
And it's a very it's very topical at the moment. This was a very convergent apposite timing, really, because the European Union is looking at things like the single digital market, the need for health data at scale and so forth, so-called big data and so forth. So EHDEN in some respects, I suppose, and maybe pulling us to the final slide, and maybe before any further questions, some kind of conclusion points. But it is it's a bold step. It's seen as kind of a flagship project, and I wouldn't want anyone to think that we're conceited or big-headed. I mean, we have been described as a flagship project within the European Union. Not just us saying it, but around conducting real-world research, within for 21st century. And at its heart, it's an acknowledgement that we developed this community, a federated network, an ecosystem, as it were, and it's all based on this, as we described earlier, this quid pro quo around data for research use. But importantly, it's about open science, open source community of and collaboration with Odyssey, as you described, and the OMOP common data model, which are critical enablers and facilitators, of course, for the project. And of course, it's still the first year.
Yes.
Yeah, so officially, I mean, we've been going for quite some time, as we said, creating the consortium and so forth, but the official year, we started 1st of November last year. And we'll go on to 2024, and no doubt further webinars and further meetings and so forth will describe our progress. But have you got any other final
well,
points?
maybe could just to explain a little bit where we are working on at the moment and what will happen in the next couple of months. So, of course, the use cases is something that we will work on quite heavily, and that's been progressing very nicely in drug utilization, but also risk minimization and other use cases on predictive analytics that are being progressed quite nicely as well. Yeah. And of course, there will be a lot of tool development ongoing as well, and that is progressing nicely. Yeah. So the question is, what's the biggest achievement? What would you like to see in years by EHDEN? When is it a success?
Thank you, Case.
Thank you for that question. So for me, I answered the question already a little bit earlier on in the presentation. I think for me, it would be if we can run a study on the data network and can answer a very important question for patient care. That is the biggest achievement that we can get, and see that patient benefits from EHDEN in that sense. So beside the fact that I'm of course a medical informatics professor, I like the medical informatics part a lot, but I think in the end it should be about the patient. So that is for me the big success factor.
I agree, and I think it's a clear realization that in Europe we have some inherent challenges, that we've already described some of them, and many of us and many of the audience know this in terms of working with real world data, and also from an industry perspective. At the end of the day, it doesn't matter if we're industry, academia, patient organizations, whoever, we're all challenged with this need for increasing evidence of what's happening in the real world. Right. But what we know is that what data we can interact with at the moment or analyze is still insufficient. And there's a lot of data out there that we would love to be able to work with. But importantly, that we enable, I think, also those data partners. So for instance, if for instance, Hospital A or Hospital Network B came on board, they also, as you were saying earlier, could conduct research themselves and unilaterally, and maybe want to look at comparative outcomes or whatever between a whole network within EHDEN, for instance. And so it's again this shift to the 21st century tools for 21st century research, which we're all kind of striving for, I suppose.
Yeah. Absolutely, and of course there are all kind of sub achievements that we also want to have, and so we want to have that network in place. We want to make sure there's enough uptake, that there's SMEs that can do the job that we're not able to do everywhere ourselves.
The education,
So those are other success factors. The question is how the use cases will be funded. So how that's a good question. In EHDEN itself, there are no data sources as part of the consortium. It's actually by design, right? So it was in the call text that we were not allowed to have data sources themselves in the use cases. So how it's been working so far in Odyssey, and that's probably an approach that we will also take here in EHDEN, is that studies are being proposed publicly, and data sources can sign up and join. So the incentive of the data sources that want to participate in the use cases is either a scientific interest or interest in that specific topic, or they want to get experience with running studies on their data. So that's one avenue, I think.
Or in the future, if it's, for instance, let's face it, if it's an industry-supported use case, that could be financial as well. Right?
Sure,
could be
that's a different story. But that could also happen.
But beyond, a bit later, I think, in terms of what we're trying to do in EHDEN.
So and as I mentioned, the use cases in EHDEN are there to develop the infrastructure and develop the ecosystem. It's not so. I actually like the fact that our project doesn't have like a disease area or is focused on only that type of disease. So we are agnostic to the disease, so to say. So we can take on different topics, but the goal here is always to build that infrastructure, build the ecosystem, help out.
It's a bit of a loop as well, isn't it? Because the use cases will also help validate, for instance, the mapping work and various other things. So it's actually also in the interest of a data partner that's mapped to work within a use case if of their interest, as it were, to help validate what's been done.
And of course we hope that some of the data sources that will be mapped through the harmonization fund will like to participate. It's not a prerequisite. We don't say you can only participate in the harmonization fund if you also run this use case. That's not how we want to operate.
We can't contractually oblige anyone. No, that won't work. No, agree. Okay.
So I hope that answers that
Yes.
that question.
Yeah.
Um,
I will flag up the final slide in the last 5 minutes or so as well, which just outlines also our entry points, as it were, or media channels, and contact points for EHDEN as well. We obviously the website. We have a specific email address, of course, for those who's old-fashioned enough to want to use email. But of course, we have Twitter and LinkedIn. Even have a repository on GitHub, right?
right. Yeah.
Yeah.
So we have a GitHub repository where we will publicly share the tool development that we will do. Yeah.
Nice.
And of course, there will be other webinars also coming up, right? So the idea of the webinars is just to give you some insight in the project. Every half year or so, or a couple of months, we will have a webinar, and that I think would touch on different aspects from different stakeholder perspectives, etc. So I think that would be a very nice way to get to stay updated on the project. And also, there's a newsletter being set up, right? So we should mention that, so people can sign up for the newsletter on the website to get more information. Also, there will definitely be questions about the calls if you are interested in signing up as a data source. So don't hesitate to ask these questions through our email address or through the form on the website.
Absolutely.
We're very happy to answer any questions.
Yeah, and in time, actually, also probably some roadshow meetings. And
yes,
yeah,
that's actually a very good point, and that's something that, as Dani and Kees explained in the first webinar, is a very good way to get people on board and to get people enthusiastic about the systems and the approaches.
Absolutely.
Trying to convince a data source by explaining the process of ETL is not very interesting. So it's much nicer to show them like the tools. Once you've gone through the hurdle of mapping your data, what type of tools become available to you and what type of interaction can you have with other data sources is a very valuable one. So having like a roadshows across Europe is definitely on our agenda, also linked to the European Odyssey Symposium, which will be in Oxford next year.
Yes.
So we try to link to that and have maybe some sessions around that as well in the Oxford session, in the Oxford Symposium. But we will travel around Europe as well. Doing these type of hackathons and study-a-thons, as we like to call them.
Indeed. Absolutely.
As well.
Yeah, I recommend it. Certainly, having been at the Oxford one, which was the subject of the first webinar in December last year, which is truly remarkable.
Yeah, it's really exciting how much you actually can achieve by just focusing for 1 week together with like 10 to 15 people and work on these topics. So.
Yes, indeed. No, absolutely. And that kind of typifies our how we want to operate and the kind of partnership nature, I think, of the project.
Yes, absolutely.
Definitely.
So I'm not sure if there are any other questions out there. If not,
I think we
will bring it to an end.
Yeah.
Thank you very much for watching the webinar, and keep following us through all the channels that Nigel just explained. And again, thank you very much for your attention.
Thank you very much. Thank you. Thanks, Peter.
Thank you.